So good afternoon, everyone. My name is Ana Carla Pereira. I'm head of unit of modernization of social protection systems unit in DG Employment and Social Affairs in the European Commission. First, and before I go a little bit more into the topic, I would like to congratulate all the partners of Sprint for their collective endeavor. I had been looking at the recommendations of the project, and I think many of them will do resonate with me and with us in the preoccupations we have right now around long-term care. And of course, Sprint is financed via Horizon, as I understand, and we are always very happy to see research projects in the area of social sciences, because of course it's not always the projects that get more visibility out of Horizon, but we are always very, very happy to be part of these discussions. I wanted to give you a little bit an overview of the points that we look at when we talk about long-term care. I have some slides. Can you, is it up? Okay. So I will also have to look there, and there is a very strong light between me and the slides, so I hope I will not get blind by the time I finish this. Anyways, jokes aside, the reason why we in the Commission and DG Employment, but also with colleagues from RTD, we are interested on issues of long-term care, is of course that they are at the core of the rights that we believe citizens should have. And I just want to start my talk referring to the European Pillar of Social Rights, where access to long-term care has been clearly mentioned as one of the 20 rights that we should uphold in order to have a stronger social Europe. And we can, of course, know this by heart, the principle, everyone has the right to affordable long-term care services of good quality, in particular home care and community-based services. But knowing the principle by heart will not take us very far, because the entire point of the European Pillar of Social Rights is to establish a political commitment to bring us all together into a path that aims at ensuring that right. But of course, the principle per se does not grant legal rights. And so, of course, projects like Sprint will help us having a clear view of where and how we can make sure that this principle is implemented. In our work, we look specifically at 4 areas. We look at access and equity. We look at sustainability, equality, and employment. And for us, these 4 challenges are essential for our collective capacity of implementing Principle 18. Let me start with access and equity. I don't know if you can see the slide. This is just actually rather fresh data from EU Silk, which is the survey on household income in Europe. This is the percentage of people above 65 that are at risk of poverty. This is 2017 data, so it has been published last week by Eurostat. And what you see, of course, is a very strong variation in the member states in terms of people at risk of poverty when they are above 65. But what it means, in any case, is that in some countries, like the Baltics, which are at the right side of the graph, is that a very big percentage of older population does not reach 60% of the median income. And that is, of course, a concern, because as you get older, and obviously long-term care services are not just for older people, but older people can be considered the prime client of long-term care services. And if you look at those figures, then you realize that if you don't have affordable services for elderly people, then many people will not be able to afford out of their own pocket the care and the service they are looking for. We do not have, let's say, robust data on to quantify the needs on long-term care, but Eurofound, if you can move the slide, Eurofound has a survey that they run on a regular basis on quality of life, and they had some questions in the last survey around long-term care. And one of the questions is how difficult it is for you to pay for professional home care services. And in this graph, what you see is on the blue bars, the blue parts, the amount of people who say that is very difficult to pay for home care services, and in the gray parts, those that say that is moderately difficult. So in any case, there is an understanding that paying for home care services is expensive in many countries of the EU. And of course, data like this, combined with the amount of people that are at risk of poverty, just gives us a signal of how difficult it must be for elderly people to have access to affordable services. And this, I say a signal, and I want to underline this, because one of the things that the Sprint project mentions is the lack of data. Mm-hmm. And indeed, this is one of the difficulties we have today, is the capacity of going beyond these general figures and trying to understand in granular terms what are the obstacles that people have, how much does it cost, who intervenes in the funding, and have this in a comparable manner across the EU, so that then we can also propose some initiatives. Nonetheless, for us, obviously, access to quality services is essential, and we do think that this is one of the areas that we have to look very closely at. If we can continue. The other aspect related to long-term care, and probably a more traditional one, relates to sustainability. And I say traditional because in the aging report that the Commission produces with the Economic Policy Committee, we have over the years projected the expenditure, the public expenditure on long-term care as a percentage of GDP. So there has been, let's say, a more constant analysis of the expenditure, and this graph shows you the last projections that the Commission has presented in the aging report, where in the blue bars you see the current expenditure of 2016, and the yellow bars add to that, and so the total would be the expenditure in 2060. And I think in all countries, the yellow bars are almost as the same size of the blue bars. So you can think that by 2060, we actually be doubling the expenditure on long-term care. And of course, this also brings an element of fiscal sustainability. We have obviously the strong objective of ensuring access to all, but this has a cost. And this cost is projected in some countries to massively increase. Now, I think these projections need to be taken with care, because what we are projecting here is current expenditure, and expenditure that is monetarized. So all the informal care that is currently being provided is not captured in these figures. So assuming we would know how much informal care costs to society, I would say these bars would go much higher in all the member states, and particularly in the states where the family network model is quite predominant. So aside the issue of access, obviously there is an issue of sustainability. And I would dare to say that in the last 15 years, we have been worried around pensions, very much on similar grounds. And we have not yet truly looked at this little tsunami that is coming. And so I think it is almost inevitable that attention will be driven to these issues as these projections materialize. Then, of course, quality is also one of the areas where we need to concentrate, because there is an element of personal dignity, of course, but also as a way of ensuring that we focus strongly on prevention, and we try to minimize the cases where care is needed because prevention was not there. I think the bottom line around quality is, of course, that we cannot measure it. And so it is impossible for us today at European level to have a sense of where we are on this topic. We do not have EU-level standards, and we don't have quantification. So it is a discussion that has started some time ago in the context of the social OMC, open method of coordination with the member states. But I would say very little has been achieved in this area. And so this is one of the areas where we have to work the hardest in order to be able to have some informed insights on the problem. I should say that in 2010, the Social Protection Committee agreed on a quality framework for social services. This quality framework somehow went in oblivion for some years, but of course we have there an interesting source of inspiration to see how some of this could be applicable to long-term care specifically. So among the four elements that I wanted to mention today, quality is definitely one where our capacity of being informed today is still quite incipient. And finally, I wanted to share a little bit some thoughts on the employment angle. There are several dimensions to this issue, and let me start just by looking at the work-life balance perspective, because we all know that most carers, most informal carers are women. And of course, this has a big impact on the female participation in the labor market. Here in this graph, we just show you the share of female population that is inactive due to caring reasons. Now, we are not capable of disentangling whether these caring responsibilities relate to children or to, let's say, other relatives who need support. So today, this is an amalgamation of those two factors. But you do see that the figures are quite important in this respect. This work-life balance dimension is, of course, a very important one, and we have given an expression of our commitment to address this issue in the Commission proposal for a directive on work-life balance, where we proposed to have for the first time a carer's leave at European level. The Commission proposal was to have 5 days of leave. The directive is currently in trilogue, also with the Parliament, and the general approach that was agreed in Council, so the mandate the Council had to negotiate with the Parliament, did not include a specific number of days for care leave. So it just mentioned the need to have a carer's leave, but not the amount of days. So even if you think 5 days is not a lot when you have someone to take care of, you can see that even that in negotiations has been difficult to agree, is being difficult. The other aspect that we need to refer, of course, related to employment challenge, relates to skilling and reskilling. We see that more and more there's a carers are becoming more professionalization. Sorry, I was looking for the accent, the word. And we do see that many people who have caring responsibilities on an informal basis are becoming becoming formal carers. But of course, this requires an important effort in terms of skilling and reskilling to ensure that quality standards are met. Normally national quality standards. And so for us, this is one of the areas that we'll certainly look at also, for example, when we will be discussing the next operational programs of the European Social Fund Plus, to make sure that countries who wish to support training of carers through ESF, they can do so, and we can establish that as a priority. And finally, there's also an issue of working conditions. A lot of carers are in jobs that are badly paid, in low pay. They have temporary or part-time contracts. And of course, this also has an effect first on the retention of people in the sector, but also on the capacity of reskilling and continuing growing in terms of professionalization of the services. So many elements around this employment angle. Now, I think what is most striking for us at European level is that long-term care is a rather complex and diverse area. When we look at across the member states, the way they finance the systems, the equilibrium between informal and formal care, the way formal care is organized is so diverse that you certainly cannot say we have one solution at European level that fits all 28 models. So it is very much on an approach of learning from each other and hopefully getting to some common ground of how we can monitor this field, that we will be able to come up with something in the future. Can we just move to the last slide? So we are currently busy in addressing those two shortcomings. First, to try to have a common understanding of long-term care across the member states and working with the member states to have comparable data. We are, in the context of the Social Protection Committee, discussing possible indicators that can be used for policy monitoring, and this is the first step for us then to be able to bring the subject in a more forceful manner in the policy dialogue we have with them. Just my final slide to say that aside this monitoring and collection of data effort that we want to, or we are having right now with the member states, we do think that is important to promote activities of actors out there who are looking into this topic and allow us to be inspired by their activities. In the Easy Progress program of 2019, we will include a call on social innovation on long-term care. The total budget foreseen is 10 million. You will see that the call will be launched hopefully a bit before spring next year, so that we are able to select the projects still next year. So the amounts will be slightly different from the magnitude that the Spring project had through Horizon, but we hope that through this call we can support further ideas that might spring out of Sprint, and certainly I encourage you to be attentive and look at the calls when they will be out. And I'm stop here. And I'll be happy to exchange at any point.
Well, thank you very much, Ana Carla. That was a really yes, thank you very much for setting the scene there. Many of those themes resonate with the work of Sprint about the need for data on delivery and outcomes of care, issues about measuring quality of care, the whole question of the balance of participation in the labour market and family responsibilities for care and so on. These are all key issues that we've been dealing with.